Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Some extreme challenges to be able to get through for home health agencies. So let's start off a little bit by looking at some of the time frames on some of the items. If you look at slide 2, the first slide after the cover slide, you see we have items 2000, 2002, and 2010, which are all completed on start of care and resumption of care assessments, which means that everything for those items have to be finished within 5 days for the start of care or 2 days at the resumption of care. Items 2004, 2015 are completed at transfer and discharge, and so those items are what we call look-back items, and we're going to have to go back to the time of the previous Oasis assessment and forward to be able to answer those. And then our last two items within medications, 2020 and 2030, which are the management of oral and injectable medications, are actually completed at a fairly regular time. For the oral meds, it's start of care, resumption of care, and discharge from the agency. But the management of injectable medications is at all time points for Oasis assessments, comprehensive assessments, because these are case mix. This is a case mix item and can contribute to the home health resource group for home health. So kind of getting down to the nitty-gritty, let's look at M2000. We're going to spend a little bit of time on M2000 drug regimen review. You have on slide number 3 the actual item. And the reason we're going to spend some time with this is because this item, which was added as a process item in Oasis C, is actually one of the few Oasis items that actually links to the Medicare conditions of participation. In the Medicare conditions of participation, the drug regimen review is required to be completed at every comprehensive assessment time point. In the Oasis, M2000 is required to be completed at start of care and resumption of care. We have just a few options in terms of answering this particular question. The first one of 0 of non-assessed or reviewed allows us to skip a number of the Oasis items, but is not a good thing because since this is tied into one of our conditions of participation, there would need to be some very specific reasons why you did not assess someone's drug regimen review. So it requires documentation at any time that you were not able to do it. And the most common time might be that you started an assessment and perhaps the patient got much worse in terms of their condition and you were unable to finish it on that first day of assessment. And then maybe the patient went back in the hospital or perhaps died or moved out of the area so that you could not finish up with that assessment on the patient. Selection 1 is no problems found during the review, and that counts for at the time you're actually doing the review, but also if you are able to resolve any problems that you found within the assessment time frame, you can still answer no assessments found during the review. And then problems found during the review, I think, is obvious. And NA, patient is not taking any medications. You could probably frame the Oasis for any patient you find with that situation, since in home health that's pretty rare that we have patients who are not taking any medications at all. So we have some things that are there in this particular area. So only this is the only process we currently have that's truly directly connected to the condition of participation. And it is not required to be completed on the very first visit, just during the start of care and resumption of care assessment. So moving on, let's look a little bit at some strategies for conducting the drug regimen review. In slide number 4, which is where I'm at, the clinician responsible for the comprehensive assessment must be the one who actually completes this question. But this is a question that allows collaboration with other members of the home health team. So we will talk about that. So clinicians can begin with collecting a list of all the prescribed and over-the-counter medications in the home, and that means not just making a list from what the patient says, but actually putting hands on bottles and looking what.
Supercoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.